Okay, sorry about that, got interrupted. So we are continuing antihypertensives, and the next category that we're looking at is discussed on page 143 on the table, and it is alpha 1 adrenergic inhibitors as opposed to alpha 2. So they're known as alpha blockers, and they end in Zosyn. These drugs pretty much all end in Zosyn, and our prototype drug is doxazosine or Cardura, and they cause vasodilation also. They lower peripheral resistance, and that helps to lower blood pressure. Just like in the video, the heart doesn't have to work so hard. Now these drugs, for some reason, they cause fluid retention in a lot of patients, and that often ends up with them having to go off of it. And so it's a good idea in this case to weigh the patient twice a week. Because of fluid retention, they'll complain about their ankles swollen, being swollen, and just feeling kind of waterlogged. And in that case, they just usually will take them off it and put them on something else. This can cause orthostatic hypotension, but then so can any of the other antihypertensive. You just have to watch. Tell the person to really be careful when they get up from a sitting position. Don't just have them take off, have them stand there for a minute. And if they are asleep and they hop right out of bed, they should kind of stay there and not take off walking. Some of these drugs will combine a blockage effect at both the alpha and the beta receptors. And so these are called alpha beta blockers instead of just alpha or beta. These also end in LOL, like the beta blockers that we talked about before. So once again, it allows us to laugh out loud at hypertension. And you want to read about some of the common side effects of both alpha and beta blockers. They're very similar. So when you talk about the beta blockers, you also want to look at the alpha beta blockers, and you can see that a lot of the things they tell you are true of both categories of drugs. We have just the straight vasodilators on page 144, and there are two of them, and the most commonly known one is hydralazine or apresyline. Apresyline is the trade name. They also lower the peripheral vascular resistance. They're going to open up those blood vessels. So once again, the heart doesn't have to work so hard. It's a good time to tell your patient, or a good idea to tell your patient to take that drug at the same time every day. So things aren't up and down. You want them to, because they're opening up the blood vessels, you want them to kind of all work at the same time. The other drug on page 144 is called minoxidil, and that might ring a bell. As a blood pressure drug, it's called Loratin, but you might recognize it by its other name, which is Rogaine. People found that when they were taking this drug, I guess because it improved peripheral blood supply, it also was improving hair growth in some cases, and so they have a dosage appropriate for men and one appropriate for women. And they might work, might make you grow a little hair. But hydralazine is the most common one for blood pressure. Now, some more drugs for hypertension that we might find. If you flip back to pages 141 and 142, we look at the calcium channel blockers, and these have been mentioned before. They stop calcium from getting into the cells, and so calcium stimulate those cells to send messages to vasoconstrict. And if that calcium isn't getting in there to help those messages get sent, the blood vessels remain dilated. So we have a couple of prototype drugs. Here we have verapamil, or Calan, and verapamil is used for several cardiac conditions, but in this case, it's a very effective vasodilator that's going to make the blood pressure naturally drop. They also use it for cardiac arrhythmias, but we'll talk about that later. Nifedipine or Procardia is another type of drug that you might see talked about pretty often. And you can see there's a number of them down at the bottom of page 142. They're very commonly used. When it comes to these drugs, you also want to watch for fluid retention. There is a slightly increased risk of Stevens-Johnson syndrome compared to the other antihypertensives, but that can be a risk with any drug. It's extremely rare, but you will see rash and blistering. In some cases, people might respond to this with arrhythmias or increased water retention. So if a person already has congestive heart failure, this could make it worse and might not, a calcium channel blocker like verapamil might not do them any favors. So it's a good idea to watch out for any signs and symptoms of heart failure. Drug interactions tend to be very drug specific depending on the type of calcium channel blocker it is. So people have to be very, very careful what kind of other meds they take with it, especially over-the-counter meds. This would be one where the nurse would need to take the product package insert, look at what interactions are possible for the calcium channel blockers, and go over what the patient should avoid. Because this can have an effect on the patient's potassium, they should eat a lot of potassium-rich foods, but not grapefruit, because remember, grapefruit and cardiac drugs don't really mix well. For the most part, it can inhibit metabolism. Many times, if you're taking this medication, you don't want to interact propranolol with a calcium channel blocker, because this can actually cause the alpha receptors to make the bronchial passages constrict. So patients who have asthma, it's not a good idea to take propranolol, especially with a calcium channel blocker. All right, I want to talk to you about a little snake. This snake is called Prill, and she comes from Brazil. And when we come back, I will tell you the story of Prill from Brazil and what it means to heart patients today.